The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, everyone. Glad you're here for the next episode of TMD Demystified. I am Tony Urbanek. Today, we are going to be talking about something that has mystified me and still mystifies me. So talking about something demystified, I have been mystified for over 15 years about night guards. And today's topic is, please, someone explain how night guards treat TMD. That is the topic. Please, someone explain to me how night guards are the solution or treat TMD even partially, because I don't know. And I have had this mysticism regarding this question for over 50 years. Now, let me state where this started. When I was and at one point in my life I was young, a dental student at Indiana University, Indianapolis, where I both received my dental degree and my master's degree in cell biology and anatomy from the medical school, I had the opportunity to attend a course on what was then at the time called oral medicine. And oral medicine was the clinic that patients were sent to where the symptoms that the patients presented regarding facial pain, jaw pain, undescribed symptoms that could not be explained in the regular dental clinic, which basically treated periodontal disease and decay, and of course, surgical problems like surgical pathology and tumors and things like that. That was all treated in the routine dental clinic. But when things came across the path of students and professors that could not be treated in the usual and customary manner in the dental clinic, they were sent directly to the oral medicine clinic. So that was part of our training, was clinic time and experience and training in what was called oral medicine. So I can recall vividly my first sojourn into the oral medicine clinic, which was manned by a young professor who had already a very strong reputation on being very smart, very aggressive, and had the backing of the university as to his great and grand knowledge of temporomandibular joint disease, which was then called TMJ, which still is called TMJ, temporomandibular joint. And so I attended this clinic along with a handful of my other fellow students, and I was in my third year of dental school, early part of my third year of dental school, 1972. And that clinic consisted of the professor and a series of 3 patients, one at a time, who were sequenced into the clinic to sit in the chair and go through a diagnosis and treatment plan, a consultation for this professor to figure out where their very strange, unusual, and undiagnosed symptoms were coming from. Why did these patients have these strange symptoms? So what happened over the next few minutes, the next hour or so, was the three separate patients were examined one at a time, and the patients were allowed to describe their symptoms, which all of them had complaints of the usual, not all the same symptoms, but the usual symptoms of headache, earache, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, vertigo, upper back and shoulder pain, and various kinds of jaw locking, and of course, plethora of joint noises. And after the patients gave their symptoms, the symptom list was completed by the professor. An examination was done of the oral cavity and head and neck area of these very unusual pains and symptoms. And then all three of these patients in sequence were given the diagnosis of, quote, TMJ. This was 1972. I was a young dental student. The one thing I knew for sure was that I did not know anything, and I was there to learn. I had already been through 2 years of basic science in anatomy, physiology, biochemistry, histology, and now I'm in the clinic applying all this basic science knowledge to the clinics. So my fellow students had a few questions about the examination and how it was done. And as the last patient left and the clinic was over with, I still had a burning question on my mind, and none of my fellow students had asked the question. I always appreciated to have my fellow students ask my questions, if possible. I just kind of kept to myself. But in this case, I had a question that I was hesitant to ask. But as the last patient filed out and we were ready to file out of the room, examination room, behind the professor, I blurted out, excuse me, but how does a night guard work to solve these symptoms of, at that time, TMJ? Of course, it's still called TMJ. And the professor spun around and looked at me, and I do not remember exactly his words or his explanation, but I remember thinking at the time it was a bunch of word salad. None of it applied to any of my basic science knowledge of anatomy, physiology, neuroanatomy, biochemistry, histology. None of it applied. It was just a non sequitur, confusing, a basic science not applied answer. Knowing enough at that time not to argue with the professor, all I could come up with as a response was thank you. But knew at that time I did not have an answer how this thing night guard worked. So for those who are watching this, either as I report it in January of 2026, especially for patients, because I know all my dental colleagues know what a night guard is, I thought I would share with patients who watch this what a night guard is. This is a night guard that comes directly from one of the primary dental labs as a example of what a night guard is. And a night guard is nothing more than a piece of acrylic or nowadays resin that is almost always clear that goes over the surfaces of the teeth. And they can be made over the surfaces of the upper teeth. They can be made over the surfaces of the lower teeth. And they do have a purpose, and they do have a very good purpose. If you have one of these things in your mouth, you can't damage your teeth by clenching or grinding your teeth together. This prevents you damaging, cracking, damaging your teeth when you wear a night guard. And I fully admit to that and agree that if you are solely interested in keeping your teeth healthy and not damaging your teeth, if you are a bruxer, clenching or grinding, whether it be night or day or night and day, some people can exert such forces on their teeth that they can crack them, literally crack them in half. And if you've ever heard a patient, especially children, who brush their teeth at night, it literally sounds like marbles breaking in their mouth. If you can imagine marbles in a patient's mouth and those marbles cracking in half, that's what bruxing can sound like. So you can put a tremendous amount of loads on your teeth as you brux, and this night guard is the first line of defense so you do not damage your teeth. However, in the ensuing 50 years of treating TMD for the first 36 years of my life surgically, doing well over 2,000 surgical cases of all types, I have done each and every type of temporomandibular joint surgery demonstrated in the literature multiple times, some of them hundreds of times, including total joint reconstruction, which is a very big operation, whether it be one side, unilateral or bilateral. I have been searching for someone to describe for me how night guards treat TMD. Now, for the past 16 years now, I have treated TMD non-surgically with a device that certainly doesn't look anything like a night guard. In fact, it has no function as a night guard. It separates the teeth, and with this little device in your mouth that we had to call the urbanic device in protocol, it does protect the teeth, because whether you are occluding on the anterior part of this device, whether you're just occluding on the front of it, or the back teeth are separated, you can't damage your teeth. But that is not why this device was made. This device was actually made to treat TMD by unloading the temporomandibular joint, not loading it. And that is the first difference between a night guard, because if you have something like this in your mouth, you literally transfer the loads from the back teeth through the night guard to the upper teeth and onto the temporomandibular joint. So you're putting the same amount of loads on the temporomandibular joint with a night guard, whereas a device that is called the urbanic device in protocol, because it goes along with a protocol, you're unloading the joint. But getting back to our night guard, I have never had in 50 years, and I've asked hundreds of doctors, and I ask thousands of doctors online, please, if you would like to contact me and describe to me, of course, bring your science to back you up, but describe to me how a night guard treats the symptoms, any of the symptoms, even one of the symptoms of TMD, temporomandibular joint disorder. I'm all ears. And I can attest to the fact that in 50 years, no one has ever approached me, not a single dentist, although I've asked hundreds and thousands, if you include my podcast and episodes on this podcast, asking doctors to communicate with me as to how a night guard works. But we know that 50% of the dentists in the United States in 2026 prescribe a night guard and tell the patient this is their treatment and service to correct their TMJ, temporomandibular joint disorder. That is a fact. And again, not a single dentist has ever argued with me about the fact that 50% of the dentists in the United States prescribe a night guard and call it TMD treatment. And of course, the other 49.9% of the dentists in the United States of America don't want anything to do with treating TMD because they know nothing works. They're the honest ones. They don't prescribe a night guard because they're aware that night guards don't treat. That's the other half of dentists. And then there's the 0.1% of dentists who I call gurus who simply use smoke and mirrors to treat TMD. Voodoo. Machines. Of course, you can describe, you know who they are because they have a stethoscope around their neck. Makes them look important. So the point of this episode is to, again, establish, hopefully, that night guards don't treat TMD, but also to invite anyone who would like to address me at tony@tmjservices.net and explain to me, if you are prescribing night guards, how they work. Because 50% of the dentists in the United States prescribe a night guard and tell the patients that this is your TMD treatment. I did an investigation recently and found that night guards are one of the most common oral devices prescribed and built by dental labs. Night guards are one of the most common devices built by dental labs, both in numbers and in revenue. Now, of course, I hope that many of those night guards are prescribed only for the protection of the teeth. And if that is the case, I would totally agree to that. You want to wear a night guard for protection of your teeth, I'm in favor. But I have had, and my colleagues have had, thousands of patients come in and say, I've been given a night guard and told it's going to treat my TMD symptoms, but it seems to make it worse. Well, that's not surprising. If you hold a piece of plastic between your back teeth, where 90% of the loads on the temporomandibular joint are from the posterior teeth, and you bite down or you brux, all you're doing is transferring the loads through the night guard into the joint. So you're not unloading the joint, and you're certainly not putting the joint in a more restful position. So I invite anyone who uses a night guard and wants to tell me how they can show me, prove to me, give me academic information how a night guard makes any of the symptoms, the disparate symptoms of TMD, headache, earache, jaw pain, neck pain, ringing, fullness, dizziness, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness and jaw locking. If you can tell me how that makes those symptoms go away, I really want to know about it. And again, my email is tony@tmjservices.net. And if you can't, explain it not only to me, but especially, most importantly, to your patients. Then cut out the nonsense. Just cut out the nonsense. The dental schools, every dental school continues to teach that the solution for TMD is a night guard. I witnessed not 2 months ago, maybe it was 3 months ago, one of the professors from a dental school university in a different state than Tennessee. I'm not going to say who it is. I don't want to embarrass them, but she knows who she was when she lectured to the Nashville Dental Society. And among other things, and her topic was the treatment of TMD, talked about, among other things, how you use the night guard for the treatment of TMD. That was as recent as 3 months ago from the TMJ specialist at an adjacent state university dental school who addressed us at the Nashville Dental Society. So this is not old information. This is right off the press, constant, common present time information, night guards are still being promoted as being used for the treatment of TMD. So please, for the patient's sake, and for your sake, also as a dentist, and for the patients that are listening, if you are addressed by a dentist and given you a night guard, ask him to describe how it works. It's not unusual. Maybe every couple of weeks I get a patient come in. I call them brown baggers. They come in with a bag. Most of the time it's a paper bag, and they shake the bag as they enter the consultation room, the examining room, and they say, "This is what I've been given for treatment of TMD. Do you want to see what's in here, or do you want to see this?" And usually I say, "No, unless you force me to. I already know what's in there." Because it's always a series of night guards that have been prescribed by various dentists. Sometimes the same dentist, several night guards, but most of the time the patient goes doctor shopping and gets night guards from several dentists. Those are the paper bag patients. This has got to stop. It's just, I mean, it's humorous, but it's sad because the patients are being abused because half the doctors know night guards don't work. Of course, they think nothing works. They don't treat it at all. They're afraid to treat it. You got your 1/10 of 1% TMD gurus who use smoke and mirrors, and 50% of the dentists prescribe a night guard. This is just really, this is the first step of getting this whole problem straightened out and getting to the point where this abuse and this nonsense stops. With that said, I look forward to the next episode. I look forward to the next time you tune in. Hopefully, I have not made enemies today. I'm a friendly kind of guy, and I would hope I haven't made at least too many enemies regarding my remarks on night guards. Until next time, I am Tony Urbanic, and this is TMD Demystified.